Namaste and welcome everyone to my new YouTube channel, Dr. R.K. Medworld. I am Dr. Ramakrishnan from Trivandrum, Kerala. I am a consultant physician here. Of late, we have seen very disturbing videos of so many people troubled with lack of oxygen and difficulty in getting admission to ICU or the wards in COVID hospitals. India now is reeling under the impact of a terrible COVID second wave. Many people who have been tested as RT-PCR positive are under treatment in their own homes, because initially home treatment is only that is required. So when does a patient who is under home treatment need to be shifted to the hospital? Usually, when the patient experiences breathing difficulty, the patient has to be transferred to a hospital. But there are certain criteria which clearly define and give a clear picture of the oxygen content of the patient's blood, which give the bystanders or the people in the home an idea as to be ready to shift the patient to the hospital. In home quarantine or even home treatment of COVID positive patients, a pulse oximeter is very much required. This is a device which will help you to understand the oxygen level. The pulse oximeter helps you to determine the oxygen level of your blood, and according to this value, we can take a decision as to the clinical condition of the patient apart from the experience of breathlessness by the patient. When we calculate the pulse oximeter, we also get an idea about the pulse rate of the patient. So these are the two main aspects which the pulse oximeter can reveal. That is, the patient is breathing room air, and in room air you get 21% of oxygen. So with this oxygen, how much is the hemoglobin in the blood saturated with oxygen? That is what the pulse oximeter tells you. And this value should usually be between 95 to 99%, because very rarely do we get 100% values, which usually even in a normal adult is not attainable. So 95 to 99% is the value that we aim at when the patient is absolutely normal. But as we know, the COVID positive patient may be having a little bit difficulty in breathing, nasal congestion, sore throat, etc. And these may hinder the perfect oxygen transfer from the atmospheric air into the alveoli and thence to the RBC of the patient's blood. So that may give a little reduction in the SpO2 value, as what is called in the pulse oximeter display. This SpO2 value can be a little below 95% also in such cases, but it should never fall below the 90 mark, because that is the time when severe breathlessness may set in. So even if you see that value in the morning a little below 90, it has to be alarming, because the patient has to be under some oxygen support, as at night the values, even when the patient is not doing any work, may further fall down, and that may hinder oxygenation to critical tissues of the brain and may result in death. So that is why the oxygenation SpO2 value, as indicated by a good pulse oximeter, is absolutely essential in ascertaining the prognosis in the COVID positive patients at home. The patient may also additionally asked to do some mild exercise inside the room, so that at least for 6 minutes this can be continued. And when this period is over, mind you, this is only a very mild exercise. The patient with a COVID positive condition is not asked to do any strenuous exercise. He is just asked to walk here and there inside the room for about 6 minutes and stretch his arms and legs, that's all. So that's only a mild exercise, and after that he is asked to take the pulse oximeter reading again. And when this reading, if it shows a reduction of 5% more than the previously determined value, that is from the resting value, that also is an indication that his alveoli may be at risk, and there is a chance of the oxygenation level falling further in due course. We have seen that in hospital admissions, the patient is given direct oxygen through various devices, and also in some cases he may be admitted in the intensive care unit and may be ventilated after endotracheal intubation. But these are all required only for a small percentage of cases. What we are seeing mostly is when the patient gets into a little bit of breathlessness, the bystanders become panicky and they search for hospital beds. But very sick patients who are very much breathless and their oxygen saturation levels have gone down to 70 or below may be in need of the hospital beds more than a person who is having an oxygen saturation of 89%. So, understanding this fact, what we have to do is to give some aid to the patient at home itself so that the necessitation of hospitalization is minimized. What we can do to alleviate the misery of such patients is what is the prime motive of this video. The bystanders have to be aware of a equipment called ambulatory manual breathing unit. This AMBU unit is not that costly, and in India in several places it is available in the range of 1,000, 2,000, 3,000 rupees, etc., depending on the various parameters that are included in the unit. But a minimal unit of this ambulatory manual unit for breathing assistance is to be purchased by the bystanders, and that will go a long way in helping him if there is a condition of breathlessness and if the patient is not able to be moved to the nearby hospital due to lack of facility or due to lack of beds. In this condition, what can be done is a mask is placed on the patient's face, which is all detailed in the description of the ambu unit assistance. That mask is placed and then a small unit is connected to that, and the bystander, one or two people have to take turns in inflating that unit according to the respiratory rate that is required, that is 12 to 14 times per minute. So you are delivering oxygen not as oxygen alone, but you are delivering atmospheric air at a pressure to the patient, so that it is better than not giving any assistance when the patient is not able to be shifted to the hospital. So this unit has to be administered at home, and this will help him or her, whoever is the COVID positive patient, to tide over the emergency situation, and the oxygenation level will definitely improve when such a measure is undertaken, because that will give a better oxygen supply to the lungs through the manual assistance. So the people, bystanders who are at home, can wear double masking and do this assistance, because as a humanitarian consideration they have to do that to their friend or relative who is sick. So this procedure will buy some time for the relatives and bystanders, so that they can get a bed that is suitable of their choice, suitable choice, and then get admitted to the hospital. Because even if hospital admission is undertaken, the patient may be shifted to the ICU, and he may be sometimes ventilated also. As you know, putting in a ventilator has its own risks, and sometimes it may be hazardous also, because in some cases the alveoli of the patient, due to some chronic illness earlier, are so weak that the usual pressures that are used in the ventilator may be harmful, and it may lead to breakages of the alveoli and total loss, so that the death and destruction of the walls of the alveoli in several cases have been observed after a prolonged ventilation usage. And that also, added to this, there is the risk of nosocomial or hospital acquired infections, which will happen when definitely the patient is admitted in the ICU And the ventilator has also been used for many other patients earlier, and there is also the augmentation of the viral load or any other resistant bacterial infection also in such ventilated patients in the ICU. So, if you don't get a bed in the ICU and if you are not getting a chance to be ventilated, you need not be so much worried about that, because you are avoiding so many infections in the process. And by the use of the ambulatory mechanical assist device that I have told, in the home itself, if the oxygenation is improving, then by God's grace you may not be requiring a hospital bed at all, because that will clear the condition. And there are also certain medicines which are helpful in to be used in conjunction with this hospital, with this in-house, that is a home care of the COVID patient. Beta 2 adrenergic stimulant drugs will increase the diameter of the airways, and under the pressure of the ambu bag, when we deliver the air, this air will better reach the distant alveoli because of this airway dilatation induced by these drugs. This can be given by nebulization or aerosol route, and also by injections or oral medication before usage of this ambu bag. Also, there are certain steroid medications also applicable in this situation. In the hospitals, during the COVID wave, we have seen several medications in use, including hydroxychloroquine, azithromycin, ivermectin, several steroids, then remdesivir, tocilizumab, etc. But none of them have given promise except for some steroid medications and oxygen. That is why the role of oxygen is pivotal in saving the life of a COVID patient. Here, at home itself, we should try to give some medication rather than just put the patient in a mask and get him into the ambulance and take him to the hospital, because patients have been moving from hospital to hospital on the mask, and this mask itself will hinder the oxygenation of the patient to some extent. And also, if the ambu bag is not used, the patient may be feeling breathless even when he is in the mask, and you are not giving any additional support to the patient who is masked. So that will reduce the oxygenation of the patient in such a condition. So this has to be avoided, and he has to be taken to the nearby hospital only when such home measures fail, because there are other medications like certain mucolytic agents like N-acetylcysteine, which can be nebulized or even given orally, so that there is better oxygenation of the blood in such conditions when you use the ambu bag. All this in conjunction with a doctor's advice regarding other clinical conditions or comorbidities which the patient may be having, and the medications to be used in conjunction with all this, that is in toto, will give a better response to the clinical scenario of the patient. I think you have benefited from this video by understanding the nature of the COVID-19 disease and the home measures that can be adopted for buying time and to alleviate the miseries of the COVID patient, and also to negate the possibility of a hospital admission if at all, and also to take the patient in a proper condition, helping him with oxygen administration until you get direct oxygen supply or hospital admission. I also earnestly request you to like my video and subscribe to my channel for further updates. Thank you.